All right, welcome back to the Elias Macko Show. Now, the dispute between the Quebec government and the province's doctors really seeing no sign of letting up. I know the government has said they'll suspend parts of the bill. Doctors not too pleased even with that. Let's take a closer look at Bill 2, specifically the performance goals, the objectives that the government has for the doctors. Are they even attainable? Aaron Derfel is the wonderful investigative health reporter over at the Montreal Gazette, and he recently took a look at Quebec's Bill 2 and those goals for the doctors, those performance goals. Aaron, welcome back to the program.
Good morning, Elias.
So let's talk performance objectives. Just what does Bill 2 say on that front?
Yeah, so that's been the whole impetus for Christian Dubé, the health minister. He's been on a mission to reform a healthcare system. He had created Santé Quebec to run the healthcare system more efficiently. Whether that will turn out to be the case remains to be seen. And now he's moved on to trying to achieve these goals because he feels that we have more doctors per capita than other provinces, but our medical outcomes are worse. So he set these goals, and if they don't meet them, then doctors' pay can be docked, or they won't earn as much. They'll earn about 15% less. And so he set 36 performance targets that have to be carried out over the next 2 to 3 years. Everything from wait times for surgery to emergency rooms to access to family doctors, and I focused on those three. And what I found out is, it's one thing to set goals, and I think your listeners will agree. You want accountability, you want to set goals, but when someone who's been covering the healthcare system, I know that we all know that there are doctors. There are nurses. There aren't just doctors who are in charge. And many of these things, when we're talking about wait times for surgery, the cancer surgeons, for example, they don't have full control over every variable. They want to operate more, but they have to rely on the medical imaging techs. They have to rely on post-operative beds that are staffed by nurses. And all of those things are creating this huge volume. We have an aging population. We have more young people under 50, who are being diagnosed with cancer. So there's this frustration that they're being set up to fail.
And anyone who works in a job that has performance goals knows this, right? If the performance goals are actually unattainable, then they're not a performance goal, right? They need to be something that you can hit at least part of the time, and any employer actually bakes that in. They know what percent of the time employees will hit those targets and not, right? When they're planning budgets.
Exactly. I think a lot of this comes from Christian Dubé's previous experience as the executive of, I think, Cascade, the pulp and paper manufacturer. He was responsible to shareholders, and you have to meet your quarterly targets, and so he was answerable to shareholders. So he's looking at volumes. He's looking at the numbers, and he wants doctors to do the same. The problem is we're not talking about pulp and paper. We're talking about human bodies. And the unpredictability of medicine, of people whose conditions can sometimes worsen, et cetera. And they also resent, the physicians I've spoken to, they resent that the implicit in Law 2 is this assumption that doctors should be to blame. That they're to blame for most of the problems associated with our healthcare system. And, there are other aspects too. You have to focus more on vulnerable patients, but that could be to the detriment of healthier patients who need to be seen by family doctors, and you can catch something early. So there's just this incredible. And they also don't like that they're being micromanaged to the extent that they're being. So what you have is a clash of values between someone who had previously come from the private sector and who was so used to the culture of meeting targets, bumping up against independent-minded physicians in a healthcare system that's in really bad shape, in part because of the aging of the population.
Now, in all of this, Aaron, there's been a lot of comparisons made, right, with other jurisdictions, and it's coming from both sides. You need to point this out. Like the doctors that are saying they're going to go to New Brunswick, they're going to go to Ontario. Manitoba held a session this week trying to entice Quebec doctors to head to Manitoba. So the comparisons happen there. But as you mentioned before, there's also the comparisons coming from the Quebec government with what the Premier said, right? Hey, we've got more doctors per capita than Ontario. Yet we have a lower percentage of Quebecers that can access a family doctor. So what about those comparisons? What is fair, what is not fair when comparing some of the performance metrics that other provinces have, the level of doctors and how pay works in those places?
You know, this issue, we've been reading a lot of stories about doctors threatening to leave Quebec. We'll see if they will make good on their threats, because Quebec actually reported the highest net gain in doctors last year from other provinces.
Wow.
It was a drop in the bucket, something like 66.
Yeah.
But Ontario reported the greatest net loss. So when doctors are considering leaving, or moving, they're looking at all kinds of things: traffic, good luck, the cost of living. It's very expensive to live in Toronto, et cetera. And so there's a certain degree of rhetoric here. Now, when we're talking about measuring one system versus another system, that's really a hard thing to indicate, but to assess. But as someone who has studied our ERs, Quebec's ERs are far worse than other provinces. It's bad everywhere, from coast to coast, but our ER situation is worse. We have more patients being left without being seen, in an ER than in other provinces. And then we get back to, the Premier's contention. He says, well, how is this possible? If we have more family doctors, when you have overcrowded ERs, that's a symptom of the healthcare system breaking down. If they could be seen by their family doctor, they probably wouldn't end up in the ER. They're going to the ER because they don't have a doctor. And yet we have more family doctors per capita than other provinces. So you can see how the government arrived at Law 2. You can see that, and it's just a very tricky situation. And I also think that what comes into play in Quebec is this very strong union culture. Doctors are entrepreneurs, but they've banded together in these two federations, and so there's a certain degree of union culture that's coming into play. We're banding together, we're rallying together, we're showing up at the Bell Centre, 12,000 of us. We have Lucien Bouchard, the former premier, who's representing us. The government is going to back down, and so far, the public opinion surveys are on the side of doctors. I'm actually working on a piece right now about how much doctors earn versus other provinces. It's a very complex issue, but when we get back down to the point I was writing about, I do think that those goals that Dubé came up with, even though he might have been well-intentioned, perhaps he should have consulted more beforehand with doctors to come up with something a little bit more reasonable rather than imposing it on them.
Well, and that's the thing, right? They're pushing through Bill 2 seemed like the heavy-handed way of starting negotiations, which hasn't gone over well. Aaron, listen, we'll be keeping track of the rest of your reporting. Thank you so much for joining us today.
My pleasure.
Aaron Derfel from the Montreal Gazette right there.
The newest tracks. Let's go. New music. And the next big thing.
Always on the new music first.
Your first place to hear it all.
'Cause you gon' like it, love it, wanna play it twice. Playing now.
iHeart New Music. Your digital station for brand new drops, fresh finds, and tomorrow's bangers.
I think we need something new.
Discover iHeart New Music. Always fresh, always first. Stream now on the free iHeartRadio app.